I'm wondering, there's been news lately about artificial intelligence being used to analyze results of exams. Have you thought about integrating that into your work at all, or is it,
I will tell you, I can't wait.
yeah?
I saw a presentation this week about machine learning and how to train them to look at MRIs and to teach them. We do have data for pathology and then also some imaging studies like in mammogram where putting human intelligence and AI together improves outcomes and it allows you to get through that work more quickly. There's a presentation today at ASCO by one of my friends that I'm excited to see again, learning how to use this in our everyday life.
Mhm. And I'm wondering, just, I've spoken to some researchers, and there seems to be a challenge of needing to understand how to use things like machine learning models. And that's a hurdle in and of itself,
Mhm.
beyond and completely separate from actually doing the research.
Mhm.
And I feel like with this evolving kind of landscape, it almost feels like new roles need to emerge.
I
What do you think about that?
I agree. I have several friends who've been interested in AI and bioinformatics. And so it's funny, I sat down with one of them and asked her questions yesterday. And there's just so much to learn. One of the speakers this week said, "You've just got to get out there. You have to put the puck on the ice," which I thought was a great analogy. So even if we don't feel confident in how we work with these models, I think we have to practice using them. They're the consumer based ones, such as, OpenAI, ChatGPT, Gemini, Open Evidence is another one that's become really popular in the clinic setting. And so I think as clinicians, we have to start using them and practicing with them. And that will help us because people are writing clinical trials right now using AI to help us find patients, analyze data. And ultimately, as a cancer doctor, if that can accelerate how we get treatments to people, we should all be really enthusiastic about that.
Hmm. Yeah, I was speaking to a researcher, actually, preclinical researcher. They're studying the movement of mice that had Alzheimer's gene
Hmm.
inserted, and she is basically a programmer. Like, I mean, she is. That's
Yeah.
her thing.
Yeah.
So she learned it, and she was talking about building models for other labs to use,
Hmm.
because it's not realistic to say, okay, also learn how to train a machine learning model. So it's
Right.
interesting how that kind of subset or field of work is a hybrid that can build and maybe maintain models across
Yeah.
specialties. But back to, sorry, go ahead.
No, I was just going to say it's really interesting because I've heard presentations this week from Microsoft and Google, and these are companies that have not been in the healthcare space. And you can hear the enthusiasm when they talk about trying to use their background and the way that they problem solve in the healthcare setting. And honestly, we have a lot of places where we could use some help. So I think it's really fun to watch non clinical people become introduced into this space. And ultimately, what happens is you are helping other people, and that makes everyone feel good and invested, and it it
Yeah.
it, it helps.